Awesome. Okay, thank you, Amanda. Thank you for introducing me and thanks for asking me to come and talk about some massage for babies and children today. So I trained with an organisation called International Association of Infant Massage, and that was back in 2017. And that's when my daughter Hannah, um, who has ASXL3, was 30, well, she was 4 at the time, and I trained in the infant massage because I wanted to learn how to support Hannah with massage. I'd read about the benefits, about how it can help with sleep, how it can help with feeding issues, with tummy problems, help to relax children, help to just generally help them feel better. And then the training allows me to teach parents of babies up to the age of 1, but also parents of children up to the age of 12 who have a disability or additional needs. So that is my qualifications. And in terms of massage, I'm also a trained primary school teacher and a baby yoga teacher, children's yoga teacher. And I've kind of dedicated my career since having Hannah to supporting families with children with additional needs, but also all families as well, and how they can massage their babies and do yoga with them and do sort of all different therapeutic work with your babies and children to help them develop, really. So I'm really passionate about massage and the benefits that massage can have on babies and children, because even with all parents, when they come, I run classes in the community for parents to come to. That's mainly what I do. And I have a team of teachers that do that as well now. But I also I go into hospitals and I teach baby massage in the local hospital. And I was there this afternoon in a residential hospital that has children with significant needs. And I go in and I teach the staff and the parents how to massage their babies and children. And the benefits are incredible. They're really, really incredible. So I'm passionate about it. And yeah, it's just a lovely thing to do with your child as well. So what are some of like I've said, some of the benefits are they can help to improve sleep. So babies, once you've done massage on babies and children, it can help them to sleep deeper and for longer. That's a really big benefit. Just helps with general relaxation. So any massage produces the love hormone oxytocin, which helps to relax babies and children and make them feel good. And the nice thing about it is it's a lovely bonding activity to do with your child, because it's not only the baby or child who's being massaged that releases oxytocin, the caregiver releases oxytocin as well, which is why it's such a lovely bonding activity to do with your child. And that's why it's often prescribed for parents that have got postnatal depression, especially to do with their babies, because it can really help with improve the bonding. And I think it's a lovely thing to do with your child, especially if you have had to do a lot of interventions or medical interventions, or it's been quite medicalized. It can just be a really lovely thing that you can spend time doing with your child. So interaction is also a massive benefit as well. It's just a special one-to-one time that you have with your child. I do it on Hannah and Esme, my 2 children. So Hannah, who's got ASXL3, and Esme, my 9-year-old, her sister. We do it every night still, and it's our special time where we just massage. We get coconut oil. We recommend you use a food-based oil if you're going to use an oil. Well, I'm going to show you how to massage your baby or child. I've got a baby massage doll today, but what the strokes I show you are relevant on your child as well. So it's the same strokes. And I do have little videos as well that I can send you that remind parents of the strokes. So we used to do handouts, but now with paperless, the way that we're all going without paper, then we just do videos so you can watch it. So I massage them every night, and we do it, and we get the coconut oil out, and I put the lavender diffuser on, and it's just a really special time. You don't have to do a full body massage every night. You don't have to do massage at night. You can do it during the day, but sometimes when the child comes home from school or if they've been out, you've been separated them for a while, it's a really nice thing to do when they come back, just to sort of bond again with your child. And it doesn't have to be a big thing. You don't have to have special oils. You don't have to have the lights dimmed and the lavender diffuser. It can just be something you do with them. So like I said, the benefits are the relaxation, helping with sleep, interaction, also relief. It can really help to relieve any pains that your child might have. So most commonly when parents come to baby massage, they're looking for support with their baby's tummy, because as we all know, when babies are born, they've got very immature stomachs and they can find it difficult to process their milk, which leads to a lot of wind and gas. And I know that many of our children suffer from this as well. So I want to teach some strokes today that will help all parents to be able to do on their children to relieve those aches and pains and to get things moving in the right direction. Can help with growing pains, it can help with teething pains, it can really just help to relax the muscles and help with any sort of aches and pains that your child might have. So relief is another heading as well. So those are the main benefits of massage and why I recommend that you massage your baby or your child. And then how do you do it? So we usually start with babies. When parents come, we usually start by helping them to massage their legs and their feet. And the reason is because that's kind of the least invasive part of the body. For babies especially, it's the part of the body they have out the most from the get-go when they're getting their nappies changed. And, you know, they generally really like getting their legs and their feet massaged. Now, as your child grows, they might not like their feet. They generally will like their legs, though. Most children like getting their legs massaged. But also, I'm going to show you how you can massage their back, their arms and their hands. Like quite often the girls will come home from school and I'll just sit and massage their hands while I'm chatting to them, and we'll have that focused time, massaging their fingers, massaging their arms, massaging their head. So we'll focus on, I think I will start with the legs and the feet just to get you used to how you might sort of some tips and what you can do with your children. Now, if your child is over the age of about 18 months, I would say go from their knee down. You know, when they're babies, you would start from the thigh, but just for sort of their own kind of modesty and things. Like obviously older children might not want their whole thighs massaged. My girls still love it because they've been getting massaged for a long time, but you don't have to go full clothes off massage, full body massage. It can be done very much to meet the needs of the age and stage of your child. But if they're liking their thighs being massaged, you can go for that. So I am going to take this as my baby, Susan. This is my third child, who is by far the easiest one that I have. And I'll just get Susan's clothes off because in the massage classes, I would be encouraging parents to get the clothes off as well. But you can do over the clothes massage as well. There's no real rules to massage. And then if Susan, so if for a baby, they would be lying down in front of you. And a child, I would recommend that if they want to lie down, they can lie down as well. So sometimes it's nice after bath or just, you know, when they're relaxed. And the first thing I always say is if you're using any oil, so if you've got a food-based oil is best because it's easily absorbed in their skin. If they get it in their mouth, it doesn't matter. So we usually recommend a coconut oil, just any shop bought coconut oil or even vegetable oil. It doesn't matter what kind of oil it is. If you're going to be particular about it, it can, I mean, officially you might say you get organic cold pressed oil, but it doesn't have to be fancy. You can just grab any oil which you have. Or if you've been prescribed creams from the doctor for eczema, for example, use that. So it's either an oil, a food-based oil, or a cream. Try and avoid anything that's petroleum based because it might not react well on their legs. So sometimes you can buy the shop bought baby oils and things. We don't really recommend them actually, or anything with essential oils because it might irritate their skin. So go for something quite natural. So food-based oil or a cream that they've been prescribed. But you don't have to use any oil. It's just sometimes quite nice to have it on your hands. They like it. So you would get some oil or cream on your hand and you would just rub. You always ask permission. A key thing about massage is you need to read the cues. Don't massage your baby or child if they're not keen, if they're not up for it. We respect our children. We just ask if they want massage. So you just cue them by rubbing the oil in their hands in front of their face and saying, "Can I give you a massage?" And then if they seem keen, you would just hold a leg and you just start by tapping the leg. And they could be sitting up as well. They don't have to be lying down. So you just tap their leg and you would just say, "Relax." and you would use their name, say, relax, Susan. And then you're just tapping their leg. And then I'm going to get you to put your hands in what we call the caring C shape. So if you have a child in front of you, you would just have your hands like this. One hand at the top of the leg, and then the other hand down, and you would just start by milking down the leg. This is just called Indian milking. So you would just milk all the way down. And again, if you were doing it on an older child, you could just go from the knee down to the ankle, just one hand down after the other. The leg and the arm strokes are very similar. So if you were doing this on your child's arm, it would just be the same. You would just be stroking down one hand after the other. Notice that I'm always trying to keep one hand on baby or child. Try not to do it that you're just suddenly taking your hands off them, you're startling them. I would just say nice, gentle movements all the way down. Then the next stroke is just what we call our hug and glide stroke. So your hands are at the top of the thigh again, or just under the knee, and you're just going to do gentle squeezes or hugs down to the ankle, and then all the way back up, and just switching hands all the way down and all the way back up again. All the way down. So again, they can be lying down in front of you, or they can just be sitting up. Then you're going to take your finger and your thumb, and you're going to place it on their ankle, and you're just going to do little ankle circles. So round and round the ankle. And with little babies, again, age appropriate, but you could just sing round and round the ankle like a teddy bear. One step or two step and a tickly under there. And you would just make it fun. Any songs that they like, I would encourage you to sing songs with them as well. Or with the older children, I sometimes just make up stories. You just make up a random story, you know, just use your imagination about anything, really. And they like that. Esme will tell me a story. So will Hannah, actually, just about what's been happening, you know, and then I'll say, oh, we're going to go round and round, and where can you go round and round? So imagine we were at the playground and you're going round and round the roundabout, you know, and you're just kind of interacting with them and just going with the flow and speaking to them. Then for the foot, sometimes they really like their feet massaged. Sometimes they don't. And again, if they don't want to get their feet massaged, they don't have to. But what you do is you start in the heel, and you stroke one foot up, one thumb up to the top of the toe, and then the other, and you just switch. So you're just doing little toe strokes over the heel horizontally. Try and get the whole foot in, and you're just stroking with your thumbs all the way up. Again, some children might not like getting their feet massaged, and if they don't like it, then you don't have to do it. Some of them will love this. My girls both love getting their feet massaged. And then you do what you call the toe roll. So then you take your finger and your thumb, and you're just going to roll the big toe, so from the base of the toe all the way up to the top, and just roll each toe one after the other. Again, you can incorporate any songs or any little rhymes. We have one here that we sing: 1, 2, buckle my shoe, 3, 4, knock on the door, 5, 6, pick up sticks, 7, 8, lay them straight, 9, 10, a big fat hen. I don't know if you have that song. We have it anyway. It's just a random nursery rhyme. And then you're just going to take your thumbs and you're going to press up and down the soles of the feet. So you press all the way up, and then you press all the way down again. And sometimes I'll just say walk, 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 walk. But again, you can make up a little story. So one day, the 3 bears were walking in the forest, and they went walk, 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 and then they came to a door. And then you take your thumb, and the next stroke is just stroking across the middle of the foot. Sorry, it's hard to do the thumb same. You're just going across the middle of the foot. But I might say, and then they open the door. Great. Open it this way and then shut the door. And then great, open the door and then shut the door. You're just going across the middle of the foot. And then you're taking your thumb. There's a little pressure point just under the toes and the ball of the foot. You're just going to go round and round here. Yes. So you're just going to go round and round and round here. And then you're going to then go to the top of the foot. So you're going to stroke from the ankles down to the top of the toe. Now I'm showing you all these different strokes, but you don't have to do them all in order. You don't have to do them all. You can just choose a variation, even if all you're doing is just sitting with your child when you're on the sofa and you're just stroking the top of their foot. That's still fine. If they're enjoying it, you just keep going. And then just to finish the leg, there's one that you do where you have your hands. Remember we did the milking down the leg? This time we're going to go up the leg. So both hands are at the ankle and you just go one hand up to the top and then you switch. This is going up towards the heart. So it's a really nice stroke for circulation. So you're just going all the way up. And again, if they were older and you wanted to protect their modesty and they didn't want to do it all the way up to the top of their thigh, just go up to their knee. So all the way up. And then a nice fun stroke that really helps to relax muscles is you just take your hands either side of the leg and you just roll all the way down. And we sing, jelly on a plate, jelly on a plate, whipple wobble, whipple wobble, jelly on a plate. Again, don't know if you have that song. Sang that in the hospital today, and one of the staff nurses was like, never heard that song in my life. So it's just some random nursery rhymes. So all the way down. And then once you've done that, you just tap their leg again and you just say, well done, relax, well done. And then if they've liked that, exactly the same on the other leg. So you would just do the same. Okay. And again, you don't have to do all the strokes in order. You don't have to do them all at all. You can just concentrate on the feet, or you can concentrate on the legs. You know, some children really just like getting their legs massaged. When you've done a part of the body, I normally just stroke down over the legs. That just kind of signals the end of massage on that part of the body. We like to use different cues, especially with children and babies who don't have language yet. It kind of lets them know what we're doing. So you always start by rubbing your hands in front of their face, even if you're not using oil, and you always ask permission. Can I give you a massage? And you know, like parents, you'll know your own child. Like, I guess I should talk about when to massage your child and baby. So there's 4 states, behavioral states that babies and adults and everybody can generally have, which we call these in massage. So active alert is when you're on the go. You're kind of like, especially with babies that are a bit, like if you think about it from a baby's point of view, they're fussy, they're maybe a bit tired, they're maybe a bit hungry, they're a bit overstimulated. You don't massage then. Crying, you don't massage anyone when they're crying. Sleeping, you try not to massage somebody when they're sleeping because you can't ask their permission, and it's just, not really what we would do. A lot of parents do want to massage their children when they're sleeping, but we discourage that. Quiet alert, that's the state when we massage them, or relaxed in older children. So when they're just quite happy, quite chilled, not too hungry, not too fussy, not too tired, you try and capitalize on that time. So you would choose that time of the day to massage your child. Sometimes parents want to do it at bedtime. I usually say, and I know this sounds a bit counterproductive, but I usually say if you're giving your child a bath at night, before bath, because sometimes after bath they can be really tired because it's quite a big event. Depends on the age of the child, and your child as well. Like sometimes you'll go to try and give a massage after bath and they're just exhausted and they're over it, whereas with my girls now that they're older, they can do that. They can have their showers, they can have their baths, and then it's just like a wind down time. But the younger they are, I usually say try and do it at bedtime before a bath or a shower. Or some parents, obviously, you're not having a bath or shower every night for their children, so do it those nights. Like sometimes I'll say one night you're doing a bath, the next night do the massage, just kind of incorporate it into what works for you. So that's when you massage them. And you always ask them, can I give you a massage? Like I was in the hospital today and the staff, like the babies didn't have any language, but in the older children, but the staff know the children. They're like, nah, he's not up for it today. He's like, I think that he's shown me that he's not very keen on massage, whereas yeah, he would like some massage. So we went for it, and a few of them got massage and a few didn't. There's never any pressure, is what I'm trying to say. It's something that we're always respecting our babies and our children of what they want as well. So moving on, I'm going to show you the tummy, because I know that that's a big area where a lot of children and babies have issues, and we can show you strokes that can really help to relieve any wind or get things moving in the right direction. This still works on Hannah. I still do it to her with her today, because she does suffer from quite a lot of constipation, and any sort of pressure on her tummy can really help to relieve that. So again, if you were using oil, you just put a bit of oil in your hands and you just say, can I give you a massage? And then relax, and then just always sort of start like I did with the legs. Just put your hands on the area that's going to be massaged, just to let them know that that's part of the body. So you just put your hands down on their tummy. And then I'm probably going to do this with Susan lying down, because it's just easier to show you. She's doing a bit of a headstand. She doesn't mind. Don't try that at home. So with your little one, you would just be putting your hands on their tummy. Then the first thing you're going to do is just cup your hands, and then start by just stroking down their tummy. Now, it's not a feather stroke. There's going to be no point to that. Start off quite gently until you get to understand how deep a stroke your child will tolerate and what they will need. But you're just doing one hand down after the other, like that. Okay. Now, if that's okay for them, to deepen that a little bit, I just want you to pick up their ankles and lift them off the floor, and you would just do it with one hand, and that just gives it a bit of a deeper, a bit more pressure, which makes it a bit more effective. So you would just go all the way down. Obviously, if your child has a peg or any tubes, then you would just avoid that area. You can still do it, just go under it. I did that with Hannah. You know, just go around it as well. It's absolutely fine. And if anyone is watching this and they have any questions after, Amanda, they can always email me. Like if they're not watching it just now and then they have any questions about how to do it, can just message me. So you would just put one hand down like that, and then the next stroke, what I would suggest is going to go around. So what you're trying to do basically is move, and this is hard on Zoom because I might do it the wrong way, is move everything along and down, along and down. Okay, so you're working with your baby along and down. I'm scared that's going to be going the opposite way, because you want to go clockwise. The main rule with massage, don't stroke anti-clockwise, because you're going to be moving everything back the wrong direction. You want to move everything clockwise. So that is kind of, if there's only one rule in massage that I say, is always go clockwise on their tummy. So again, you would just take your left hand, try and keep your fingers together, and just place it down on their tummy, and then just start circling in a clockwise direction. Okay, so you're just doing big circles. Sorry, Susan is upside down, just so you can see. So you're just going clockwise on their tummy. And again, my favorite little rhyme would probably come in here, round and round the garden, just because it's about going round and round. Sometimes I'll sing Twinkle Twinkle Little Star, anything. Here we go round the mulberry bush, just whatever songs come into your head. Wheels on the bus go round and round, go round and round. And then I would say bring their knees up to their tummy. Now, if they can't bend their knees, that's fine. If they don't want to bend their knees, just lift their legs up and down. But you're just trying to release their spine, strengthen their spine, and just relax their hips. So you're just going up and down. And I sometimes say a little song, slowly, slowly, very slowly, faster, 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 and then just release their legs and stop, and just let their legs fall down. So you've done round and round like that. We're going to do more round and round, but just a bit more pressure. So using the pads of your fingertips this time, not your whole hand. You're going to start at the left, and what you're going to try and do is do an upside down U. Okay, so we're going to just do little circles on their tummy. So with the pads of your fingers, you're just going to start. I'll move Susan. You're just going to start going up and around across the belly button, and then down, and then glide under. So again, you're just doing little circles. Now, if there's any trapped wind, but like bubble wrap, honestly, you can just pop it because you're just doing little circles round and round. So think about that when you're doing this. And also, if you're a bit constipated, it's moving everything in the right direction. And then down and glide across. So up and then across. Do it 3 times and down and glide. Okay, so that's the circles, the tummy circles all around your tummy. Another nice stroke is when you use your whole flats of your fingers and you're just going to do I love you. So you're going to try and draw I love you. Again, it gets everything moving. So you're just going to say I, and then draw a sideways L, love, 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 and then an upside down U. You, you, you. Okay. And then the very last stroke you're going to do is just again using the flats of your fingers. I just want you to walk across the tummy. Walk, 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 walk. Just always think about going clockwise. Walk, 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 walk. Again, walk, 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 walk. And then just go back to doing your cupped hands down your tummy. And you can do a few more knees up to the tummy. You can just sing your little song again, slowly, slowly, very slowly, faster, 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 and stop. Okay. So there's the legs and the tummy. And I don't know if you just want me to continue to talk a little bit more about other massage that you can do as well. So see, we've got more strokes you could do for the chest and the arms and the hands. The arms and the hand strokes are very similar to the legs and the feet and the back. Okay. So I could go through them, but I also want to make sure that we've talked a lot about kind of more less structured massage, but more massage for songs and stories, because it doesn't have to be following set strokes. I'm also trained in a program called the Massage in Schools program, where I go into schools and I teach children how to massage each other. Now, that's only on their heads and their backs and their arms. You obviously wouldn't be asking children to massage each other's legs and things like that. It wouldn't be appropriate. And they do it whether one's sitting on the chair and the other one is behind, and then they switch. And a lot of that is, there's a way you can do it where there's like 15 strokes that you can do that they build up on, and I show them flashcards up on the board, and they kind of do it over a 5-week period, and they learn 3 strokes every week. But basically, it's all about doing it for songs and stories and making it fun. So they would always start again by asking, so say there was one child standing behind another, they would always say, and this is when I was going to get Esme to help me today, but she's at after school club, so sorry about that. One would stand behind the other one, and they would turn around and they would say, can I give you a massage? So if it's a parent doing it on a child, it's the same thing. You would just say, can I give you a massage? And then if the child said yes, or, if they intimated yes, sometimes in the classes they'll say no. Usually in weeks 1 or 2, some of the boys will be like, no. But then after 5 weeks, the boys are like, yes, they get really into it again. It's just, they don't know what's going to happen. So they don't know, they just say no. Some children don't know what's going to happen. But then you would just start by placing your hands on their shoulders, a nice ground and stroke. And then you would just sort of tell little stories. So the first one is you'd put one hand up on their forehead, okay, and the other hand Yeah, sorry, I'm just remembering it. I was trying to look for the cards earlier and I've actually left them in a primary school, which is not great. I could always do another session, Amanda and Sarah, where I do it specifically for children and come and show you all those cards. But basically, it's just about fun strokes that you could do. So, one you can have, there's a cat on the roof. So, we'll do that one. And then the cat comes down off the roof. And then the cat climbs back up on the roof again and comes down off the roof. So that's just a nice simple one where you're just stroking down over the shoulders. Or you can do it the baker where the baker's kneading the dough. So you're just doing little circles up on the shoulders. And then you're going all the way out and then all the way back. And then it starts to rain and you're just doing raindrops down their head. And then it's time to go and visit the hairdresser. So you're just at the hairdresser, you're getting your hair washed, and they stand behind each other and they just do like a nice little head massage. And they go around like that and they put on calm music. So we're just doing little massages there. And then you can go back and they can do their arms. They can do one hand down over the other, just milking down the arms. Like that. And they do it at the other side where they're just milking down the arms. And then they get to the palms and they do what we call little bunny hops. So you just take your thumbs and you just go hop, pop, 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 just a little pressing up and hop, pop, 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 and bunny hops, hop, pop, 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 and then all the way back up. And then you just hold a hand and you just stroke on top of the hand like that. And you can do your little finger rolls as well, where you're just rolling each finger all the way up. And then you go back up the arm just by doing the milking all the way up. And then you just take your hands and you just do a fun little rolling stroke all the way down and all the way down again like that. And then you just stroke down and you can do that on the other arm and on their back. Just turn around. Lots of different strokes you can do for babies as well, but for children on their back, I would just be concentrating on really simple, because I mean, they're not massage therapists and parents aren't either. We don't expect you to be. We just want you to have fun and just do some nice strokes on their back. So for their back, you would just be starting on the head and then you could just stroke all the way down the back. Okay. And then you could have the pads of your fingers again, like we did on their tummy. And you would just be doing little circles all the way down their back, one side of their spine. Yeah. And all the way up the back again. And then you would just go to the other side and just circles down the spine. And circles all the way back up again. And then a nice one to do and as easy as just open your hand and you just do you just stroke all the way down their back. Like that. When you've got babies, to encourage a bit of tummy time as well, which is quite often difficult for little ones, you can do the same strokes on the back, but with baby across your legs. Now that's really supportive. If you can imagine the difference between trying to get a baby to do tummy time like that, where they're just like, help, feel abandoned. The difference between that or supporting parents to do it with baby lying or toddler lying across your legs is so much better for baby or child. They feel so much more supported, but they're still getting the same strength work on their head. And even if you put something under them as well, like a mirror or a book which's got crinkles or something that's engaging for them, under them that they can look at, it's usually a lot better. So again, you would just take your hands and again, can I give you a massage and just rest your hands on their back. And you would just be going backwards and forwards all the way down to their bum and then all the way back up and then all the way back down. Now, if they're liking that, you would then just put one hand on their bum and then just stroke, just quite a firm stroke, your cupped hands again all the way down. Just going to show you a few more strokes and then again, the pads of your fingers. I'm just trying to keep it simple to show you things that you would remember that you're doing in different parts of the body. You would just do the same stroke that I showed you before. You would just circle all the way down one side of the spine. You can even do their bum, quite like their bum being massaged, because who wouldn't? And then all the way back up. And then you can do it on the other side of their spine, all the way down and all the way back up. And then just open your hand. And if you think about that, like how you can incorporate all, like I was saying, songs and everything as well. You can have the wheels on the bus go round and round, or you can have the wipers on the bus go swish, 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 swish. You know, you can do all sorts of songs and rhymes as well. And so that would be their back massage. And then you would just go down, and then I would finish by opening the hand and just stroking all the way down. But if generally, like, the girls will just want any random song or story, you just go with the flow, you just make it up. So like a common one might be Incy Wincy Spider. So you would just maybe start with Incy Wincy Spider climbed up the water spout, and then put your hands on their head. Down came the rain and washed Pudency out. Then you could draw a sun. So in the right direction, out came the sunshine and dried up all the rain. And Incy Wincy Spider climbed up the spout again, you know? So you're just doing it with any songs that they know, or you can have a rainbow song, red and yellow. You could just be drawing rainbow colours on their tummy or on their back, red and yellow and pink and green. I can sing a rainbow, you know. I just usually say to parents, just have fun with it and go with the flow. Make up any songs, and stories are good as well. Like one day, Esme came home from school and she was so hungry. So she decided to make a pizza. So you're drawing a circle for the pizza, and then on the pizza, she sprinkled some cheese. And then she put on some pepperoni. And then she put it in the oven. And then closed the oven door. And then she waited and waited. And then the pizza was ready. And she took it out of the oven again. And then she ate it all up. You know, just anything random like that. You're just making up a little story about things that are happening in everyday life as well. So yeah, I think I've talked enough. I don't know if that's been helpful or not.
It has been. This has been so calming. I'm not even receiving massage, and I feel very calm just listening to you, Lesley.
That's what it's all about. Do you know, it is, and it's about having that mindful time with your child where it's just dedicated one-to-one time. And I think when Hannah was younger, I used to find it quite difficult sometimes to find things to do with her that were meaningful and that were lovely. And half the time I was shoving a feeding tube down her nose or something. So, like, to actually have a really lovely, nurturing thing to do with her,
Yeah.
where we could put the music on and get the oils out, was really, really special and really calming, you know.
That's wonderful. Well, I think we can, if you're willing to take some questions, we can see if anybody here has any questions. I know maybe while people are thinking about what their questions might be, I know as you mentioned, some tummy troubles are really common, right, in the ASXL disorders, and you gave some great tips and suggestions for different massage movements to do. Is it possible to do too much of it or too little of it? What's your guidance on sort of quantity in working on tummy issues?
So I no, you can't do too much of it. So you can never over massage your baby. When I say before, like, it's a good question because quite often parents will ask me this. And as I said before, the optimum time is to do it when babies are in that quiet, alert state. That's great, but the only time I would say not that that's the case is if your child has a really, really sore tummy, right? Because some parents come to me and their babies are really distressed a lot of the time, and they're not getting that quiet alert time because they're really sore. They've got a lot of wind, they've got a lot of constipation, there's a lot going on with their tummy. So in that instance, I just say it's almost like a prescription I'm giving you. I'm like 3 or 4 times a day, do the tummy massage. because you will see benefits. And the more you do it, the more, because it's got a bit of a cumulative effect as well. Like if you do it in the morning and then do it again lunchtime and then do it again mid-afternoon and then do it again in the evening, you will find that there will be more of a benefit than if you wait until there is a lot of trapped wind or they are quite constipated. So the more you're doing it, the more you're manipulating everything. So I would just say as often as you can. Yeah, that
Thank you.
help.
Yeah,
Mhm.
yeah, that's great. Do others have questions?
Yeah, I had a question. Um, so my son Sammy, he has Shashipania syndrome. He's 9 years old, and he has struggled with constipation his whole life. He has a G tube. The G tube gets sore on and off. And then he has sensory processing disorder too. So when he was a baby, the only time he was happy is if he was like completely swaddled, like squeezed so tight. And diaper changes were just awful because he wasn't being squeezed. And
Mhm.
I swaddled him till he was probably 6 months old, like beyond what they recommend, right? Because that was the only way he was happy.
Mhm.
Um, and I had an occupational therapist teach me that I love you. That was like one trick that she gave me to help with this constipation. So fast forward,
Mhm.
9 years now, whenever Sam still struggles with constipation and has a very robust regimen of things to support
Mhm.
him to be able to just go every other day.
Mhm.
Um, when I try to do the I love you, it is like he's laughing, but it's almost like just so overwhelming for him. Just it's like kind of tickles. I don't know if it hurts. I don't know if he's not sure what I'm doing. And so
Mhm.
I guess that's my question, like for kids who have sensory processing disorder, whether they are seekers or avoiders, how
Mhm.
do we kind of navigate that with massage? Because I have seen the benefits of massage. Even just listening to your voice, I was like, I want her to come rub my shoulders. This is like heavenly. And so of course I want to have that experience with Sam, but that is a roadblock that I've experienced with massage.
Well, and yeah, that's why when I'm saying to parents, if they come to me and they say, I'm, I'm asking them to do it for just their tummy, I should also say that I would just be saying only do it for tummy. Don't try and do it for tummy and then have a nice relaxing time doing the legs and the feet, because the kids are going to get mixed messages about massage. They're going to see it as
Sure.
something not a relaxing thing. It's something that's maybe, can be a bit sore for them. So I would say do not massage his tummy if he's got this association. I would say go to massaging another part of his body first. So
Okay.
get all about the tummy. If you've got something that like he's taken that's regulating his tummy, I would get away from the tummy. If he's got any sort of, as soon as you start touching his tummy, he's like, oh, I remember this and I don't like it. Well, I
Yeah.
would just go to like his legs and his feet. I would
Okay.
try and do his legs and his feet, or I would try and do his hands and his arms, whatever he's going to enjoy, and build back up with the fun, relaxing element of massage. Yeah.
Yeah.
And if
Yeah.
he then starts to tolerate you, even just resting your hands on his tummy, build up to that and just go with the very simple cupping your hands down his tummy. Don't go back to doing the I love you strokes.
Yeah.
Away from that. Does that make sense?
It totally makes sense. Yeah.
Because you're trying to make it about a relaxing thing
Yeah.
rather than a medicalized way of working with them, which a lot of her, again, like I know that from Hannah, like I was taught that I love you strokes from when she was a baby, and I used to do it on her, and I used to be quite frantic about it because I'd be like, come on, just work, just get
Yes.
out.
Yes.
And you're stressed, and they sense that. So it's kind of like, right, let's just forget about that. Let's go. And I had to start with Hannah, just the legs and the feet. And then that's why we always start with the legs and the feet, because it's kind of the least invasive part of the body that they generally respond best to.
Yeah.
That hands and their arms. But again, quite often with their hands and their arms, it's a bit unnatural to get them massaged because you're moving them.
Sure.
No, you're like, well, I don't know if I like this. Some of them, you know, but then I would go with the legs and the feet and then move to the hands and the arms and like just build up. Yeah.
Yeah. Yeah. That makes a lot of sense. And I could resonate when you were talking about how like parents just want something that is enjoyable to experience with their child, because so much of my care with Sam is not enjoyable things, or it's just, changing diapers, doing feeding tubes,
No,
medication, doing stuff that's not fun.
physio, putting them into
Yeah,
positions they don't like to be in, you know,
right,
like
right.
sort of stuff. So massage just should be just about let's just enjoy it, you
Yeah,
know.
yeah.
Yeah. Mm-hmm.
Thank you.
Try it. I'd love to hear how you.
I will. Yeah, I'm gonna try it. I'll see how he does.
And a little bit often, if he's not enjoying it, just stop. Just be like,
Yeah.
oh yeah, you know, and try and choose another time that he might enjoy it.
Yeah, yeah, I'll try it.
Because that boy in the hospital today, like one of them, is built up over time that he didn't really tolerate it, and now he loves it. I go in and he's like, I mean, the caregivers are massaging him, and he genuinely loves it. It's like the highlight of my week to see
Oh,
changed from being like, no, no, just turning his head and giving all
yeah.
the of like, no, don't want it, no eye contact, to now he's like, oh, it's great. And I even got a little smile today. It's brilliant. So don't
Oh,
a little bit often.
yeah, yeah. Okay, I'll give it a try. That has to be so life-giving for you to be a parent of a child with complex needs, and then to be able to go and help other families, and it's really cool.
Feel really blessed actually to do what I do.
Mhm.
Well, thank you, Lesley. This has been really wonderful and a true hands-on session, and really appreciate you sharing your expertise and your own personal experience. And it's been just lovely getting to know you since we met you at the conference a couple of months ago.
Trip all the way over from Scotland, like I really feel like it benefited me so much to come and meet you all. Although it wasn't easy with Hannah on a plane for 8 hours. I'm kind of now.
Yeah, it's like, yeah, giving birth, right? You forget the parts that are really
Yeah.
difficult and traumatic, and you just remember the good parts.
The meal and like all the fun times and all this. No, but it was brilliant. Much
Wonderful. Well, thank you so much for sharing your time and your expertise. We're really grateful for that and for you, and give our best to Hannah. All
thanks for asking
right.
me.
Bye, everybody. Thank you so much.
Bye.
Bye. Bye.